And now joining us live is the Senior Registrar, Department of Community Medicine and Primary Care, Federal Medical Center, Beakuta, Dr. Oludolamu Adedayo. Good evening. WHO has issued a alert as high-risk season for meningitis, stating that from October 1st, 2022 to April 16, 2023, a total of 1,686 suspected cases, with about 32 confirmed cases, and deaths have been reported in 22 out of 36 states, including the Federal Capital Territory. What do you make of this?
Thank you, presenter. Yes, meningitis is a seasonal disease. It's the disease that's caused as a result of inflammation of the meninges
Right.
covering the brain and the spinal cord, and caused by bacteria, viruses, fungi, and the rest. But commoner is the bacterial meningitis. So it's seasonal, and it's between the month of December to June, but it peaks around March to April. So I wasn't surprised about that rise that we got over the last 4 to 8 weeks from those states that are being affected at the moment, because that's the peak period of that's when we have no air humidity in the weather. So that's when we have we expect such occurrences. But as well, it's a public health emergency, so the National Nigeria Center for Deadly Disease and Control and Prevention are already on their toes. Surveillance is ongoing. They are doing some active case finding, and they are also, with the help of WHO, preparation is ongoing to curtail this epidemic.
Okay, before we go on, is there any layman language for this name meningitis?
Well, in Yoruba language, they say euro because there are some triad clinical features that we do that's classical of this, and that's fever, headache, and neck stiffness. So sometimes they call it euro in Yoruba. I can't really say other parts of the country do what they call it. So in layman language, that's the way it's presented.
All right, now what can be done towards ensuring the states across the Federation are free from this disease?
Okay, so like I said, when we have epidemics like this, we're ongoing right now. We have mass vaccination of people that are affected and their close contact. So there is also surveillance ongoing to know those that have had contact with those cases. And we should also be educating our people like we are doing now. Let others be aware of where it is. At the moment, it's just about where we have the epidemic ongoing. It's just about 7 states in the country where Jigawa has the highest number of cases that have been confirmed, followed by Zamfara and some other states. So it's really in the northern part of the country. But Oyo also has confirmed a case, so which is trying to tell us that people, if you are traveling, cross-border transmission can occur. So we need to be highly suspicious. If we can avoid close contact, we can avoid overcrowded area, and also our hygiene is important. So all these measures can be put in place to reduce the harm.
And in terms of budgetary allocations now, what is best in tackling such communicable disease? In terms of budgetary allocations, what's best can we apply in tackling such communicable disease?
Well, because it's communicable disease, it's treatable and preventable. This disease is we have vaccines that are being used. So children between 1 to 29 years are advised to get vaccinated, and older adults age 65 and above have some vaccines that prevent some of the organisms that could cause meningitis. So the Nigerian MPI schedule, We have the vaccines that is free. You should go to government hospitals and be vaccinated against meningitis.
All right, thank you for being part of the news at this time.
Thank you.
And that was Dr. Oludolamu Adedayo, Senior Registrar, Department of Community Medicine and Primary Care, Federal Medical Center, Calcutta.